cat that needs a blood sample to be taken, the fundamental principles of cat-friendly handling should be applied. Place a towel on the table so that it is warm and not slippery for the cat. Move slowly and calmly and reassure the cat by talking and stroking it. To ensure the environment is calm and quiet, preparation is important. Ensure you will not be disturbed in the room and all equipment required is within reach. Small, quiet clippers are ideal. Start with them behind you to reduce the initial impact of the sound. Half-mil tubes are useful to reduce the amount of blood required to correctly fill the tube. After clipping, the jugular vein can be seen. Apply local anaesthetic Emla cream and leave for 20 minutes to take effect. Sit the cat comfortably on the towel. Your assistant can place her body behind the cat, slowly raise the cat's head with one hand, and place her other hand over the cat's shoulder. You can then raise the vein and take the sample. The cat is reassured using a quiet and soft voice.
Good boy, Scraps.
Note how the cat has its head held under the chin without raising the head excessively to avoid discomfort. The assistant's other hand restrains the forelimbs, with a finger between the legs so they are controlled but not pressed together uncomfortably. The assistant is behind the cat to prevent backwards movement. The cephalic vein is an alternative site if the cat is not comfortable with jugular access. A large, soft towel can be used to wrap the cat to help it feel more secure. A forelimb can then be exposed. Here, the assistant's body and right arm gently restrain the cat whilst also raising the vein. When accessing this vein, avoid overextending the limb and keep the cat in a natural position. This cat is reassured and stroked during the procedure. When the cat reacts to placement of a dressing, the assistant places her hand over the cat's head and neck and pulls the cat closer to her body, providing more control whilst continuing to stroke and reassure the cat. The medial saphenous vein is another alternative site for blood sampling. This can be useful in cats that like to remain in sternal recumbency. The cat can be gently held against the assistant's body. This relaxed cat is restrained by one person while another takes the sample. However, 2 people may be required with less cooperative cats. One person to gently restrain the head and forelimbs and another person to hold the hind limbs. As before, the cat is held on a large soft towel. The hind limbs are not overextended and gently directed towards the person taking the sample, who restrains the lower leg. The assistant gently holds the cat against her body and the other leg out of the way. She continues to stroke and reassure the cat whilst the vein is raised and a blood sample taken.